You are listening to Lifeboat for the Whitecoat podcast.
Welcome to the Lifeboat for the Whitecoat podcast. This is the initial podcast of all of the leaders and the members of the Lifeboat for the Whitecoat initiative. I would like to introduce to you Matt Ort, Heather Nill, and Phil Cole. And my name is Amy Schultz. All of us are leaders about the healthcare space and the mission to change the paradigm of what is happening in the future. I would like to introduce to you Matt Ort to share with you why we're here and what to expect.
Yeah. Hey, everybody. Good morning. I'm excited to be talking about this. This is I think, going to be a really important initiative. I think it's going to help a lot of people. I think it's going to fix some inherent and kind of long-term problems that have been affecting physicians and that have been affecting employers. And so, yeah, very excited to talk about it.
Heather, is there anything additional that you can add?
Well, from a practice management standpoint, I've got a lot of history supporting doctors in a number of different fields in the healthcare space. And what I've begun to see in this trend is that there are a lot more doctors that work for hospital systems that are burned out, stressed out, and looking for a way out in order to find more balance in their life and be able to give more time and attention and care to the patients that they serve. As a mother, I couldn't be more excited about this mission and bringing my experience and wisdom and knowledge about revenue cycle optimization, helping bring creative financing to the table if that's what's necessary, and also just to be a trusted resource and bringing a network of advisors to their team to get them launched, steady, stabilized, and growing.
Thank you. And then Phil, what can you also expound on regarding the growth in this specific healthcare market?
Well, I just think that the most important thing is when it comes to looking at starting your practice or needing that help, there's so many times that we find doctors not utilizing healthcare professionals. And that's what this is all about, making sure that you're getting a bunch of healthcare professionals that have the unique insight in different areas, but as a team to be able to support them and support you as physicians to be able to know and not feel as though you're out there by yourself all alone, but that you do have a team that's surrounding you. And if it's not just us as the team, but that we have all the other components that we can reach out to help guide you through the whole process and through your career as well.
Excellent. I'm going to switch really quickly to, I guess, the reason why all of us have met. One of the main reasons is Matt Ort has really been shaking up the healthcare industry over the past 10, 15 years. And Matt, if you can just share a little bit, I know it's a long story, but if you can, break it down to a shorter outline of why you are here and why you are so passionate and speaking around the country about how the healthcare is changing and literally how you have discovered ways to actually move that change.
Yeah, it's a great question. And because of the complexity, it's hard to keep it brief, but I think I've gotten fairly good at that. So we'll see how I do. Yeah, we have a collective problem in our country in that physicians who are really, you would say, the sellers of healthcare are very frustrated, and the buyers of healthcare, which is primarily at least half of the market of the commercial side in the country, is employers and their employees. And so we have a lot of middlemen, we have a lot of big insurance influence, but we have the core people of this whole process, the buyers and the sellers, frustrated. The employers don't have a sustainable path. They're finding healthcare to be unaffordable, and it gets worse every year, and the cost goes up. The physicians, especially, which is really more of the focus of this, right, is that they've gone to school, they've gone to residency, and they've invested their whole careers in this path, and a lot of money as well, and a lot of time and hard work. And they get into these big systems, and they're not really allowed to practice like they know is best, like they dreamed of when they started that long journey. Primary care, for instance, really has become more of a funnel and more of a referral machine. It's really not the primary care that we knew 30 or 40 years ago that actually had time to spend with the patient and was accessible outside the visit as a phone call, and really got to root causes of chronic conditions and so forth. We've gotten into this, it's evolved to this kind of just money machine that doesn't really heal anybody. It just kind of strings them along the rest of their life, and that's very profitable. So one of the things I've heard in the last many years, as you mentioned, is I roam around the country now and the book's out, and I spoke in 30 cities last year. I talked to many physicians. I talked to a physician in Texas yesterday and North Carolina, two different physicians. Both shared with me, both had gone independent, and they shared with me their stories about having gone to medical school and having these dreams, and then feeling very stuck and very frustrated and overwhelmed with patient panels of 2,500 patients when they know it really should be 500 patients to be able to take care of their patients, their people well. And so they broke out. But the issue within the country then is all these physicians in the systems. What do I do? Right? I'm very frustrated, and what do I do? And so the Lifeboat for the Whitecoat website, and that's why we named it with a kind of a name that gets your attention. I don't think it's just healthcare recruiting, and I don't think it's this bland thing. We're part of a movement here. We're part of a direct care movement that is about employers having alternatives, and direct care happens to be far less cost and far greater quality. And as we open that up and break through those network walls, we want to give physicians a path to go independent. And of course, that involves different things. It could be joining a practice that's already going. It could be starting a practice, which is Heather and Phil can expound on that. But we're going to support physicians in this movement, and it's going to open up many doors for employers as a result.
You are listening to Lifeboat for the Whitecoat podcast.
You had mentioned that you spoke to two doctors in Texas and North Carolina yesterday, and you heard their stories. I just want to tease a little bit. In the future podcasts, we are going to be bringing on certain physicians and doctors that literally left the healthcare system and have a very successful practice on their own independently, and they will share the ups and the downs, what to watch out for. Matt has helped guide a lot of these folks away from the healthcare systems. And I'll just say this, he didn't just come up with the concept just on a whim. He literally was working for a large employer and saw the opportunity to, and you know what? I'll just let you explain a little bit, Matt, of where your start happened and why what worked for you as an employer is now working for the independent practice owners.
Yeah, I always say that I find myself on an unexpected path. I had a near just close to 25-year HR career, mostly in manufacturing. And I say humorously, the first 2/3 of that career, I was passionate about a lot of things related to HR, and benefits wasn't one of them. It was actually one of the most boring topics that I saw, and I kind of got through it just like most are doing today. You go through kind of the month. It really should be the whole year, but you go through the month of it, and you have your enrollment meetings and you move on. And I was kind of challenged by owners in the last 1/3. I was the VP of HR at Merrill Steel. I had just started the role, and they said, we've got these unsustainable health costs. Is there anything we can do about it? And that really sparked a learning journey for me, and it sparked a health plan transformation that happened step by step. Kind of a little bit out of order at the time. I was learning. We were learning as we were building the plane, as we were flying it, as I know today, but we were very successful. We saved employees in the company and the self-funded health plan millions of dollars. It got noticed. We won a bunch of awards along the way, and started to get requests to speak, and even requests for how did we do it. And so that's where the book came from. It's really the second book of its kind. It's called Save Your Company, Don't Feed the Beast, the Employer Healthcare Success Formula. About 5,500 copies out there since it was released in July of 23. And that's a guide. That's a guide for employers. It's also a guide for physicians. There's a lot of nuggets in there of how physicians can be a part of this direct care movement that's really exploding in America. So I left Merrill Steel and co-founded Self-Fund Health with another gentleman from Madison. And that was a health plan to help Wisconsin and the Midwest. And that's going very well today. And then recently I've sprouted for another change kind of unexpectedly, but now I'll be working, launching a new health plan in Texas, and then we'll scale that nationally. But it's really about giving employers solutions, because when they go out and shop for a health plan, all of them are really, most of them are unsustainable. And so we partner with the doctors who break out and do direct care, both in the primary care and the specialty. We call it direct primary care and direct specialty care, or really just direct care. And we put that as not only an option in the health plan, but a free option that's now not only in network, but free. And so there's a lot of the barriers there where if doctors break out today, they are automatically out of network on most plans. We have a way to fix that, and then we transform the health plan as well. So we break through some of these walls that this very wealthy industry has built, and we help people find their passion and their dreams again. And it's quite inspiring to watch that happen.
Yeah, you just mentioned a key phrase. We have a way to fix that, right? Mm-hmm. And that's what these folks who are lost in the abyss of the healthcare situation, they need somebody to help them, grab them by the wrist and help them walk through, another opportunity for them. Heather and Phil, what can you share along the lines of what you have seen in your years and years of experience?
We've all been in situations where we've hired the wrong contractor, or things have set us back financially and in time. And the whole purpose of why I was so passionate about talking and meeting Matt and then pulling this group together to do what we're doing is to prevent the loss of precious time and resources of capital. And especially when you're starting any business, but direct primary care, direct specialty care, especially because they have the challenge of the insurance being out of network. And we have to shift the way that patients find them and choose them. It is going to require diligence and knowing the right people and pulling that board of advisors together early on so that every step made is on solid ground with great advice and a team behind them to support the opening and sustenance of the practice. So that would be my thing, is just pulling the right advisors together.
You are listening to Lifeboat for the Whitecoat podcast.
Healthcare industry does not get business in their education, or very little, if any. And so it's just making sure that they understand how to run the business. But in the situation of wanting to do that break off and go out on your own, like Heather said, getting the right team around you, but then having somebody that can help understand all the aspects of the business. And when you're putting that practice together, have someone that's put the practices together before, because we see so many times the mistakes of, I have builders, I have accountants that are family, or my best friend's a contractor, and a lot of those things you just got to be really careful with, because you want to make sure that when it comes to the healthcare industry, it's a unique industry. That's I guess the best way to put it. And with it being a unique industry, you got to make sure that you stick with the unique people that work it all the time and are in it day in and day out, because there are a lot of nuances that you do not see in a normal business, like a dollar store or something like that. Those are just regular businesses. What we do, all of us here on this podcast, what we do is unique, and we have a lot of years of experience behind us in learning all those nuances. And so I think it's really important for everybody. And what we're going to have with the next episodes coming up and stuff like that are all going to be those things to just continue to glean and learn. And I think it's really, really important to make sure that you educate yourself as much as possible, because like I said, for me personally, being in it for 30 years, I still learn every single day. And so hopefully we can take our experiences and our knowledge and push it off to everybody that listens, and you feel comfortable more and more on what you want to do with your future.
You are listening to Lifeboat for the Whitecoat podcast.
Perfect. I mean, the healthcare industry is scary, both from the MDs, the doctor standpoint that are leading or trying to keep the hospital systems afloat, right? It's also scary to think about leaving and sort of being on your own island. And this podcast was created to share with you that you have support. You have people that are in it that can help you walk you through whatever the scenario is. And I want to sort of transition into that. Our podcast is the future podcasts are going to be based on not only our experience, but also what you want to hear and talk about as well. So I want to make sure that you have an opportunity to follow us. So you're going to be able to find us on Spotify and on YouTube. And you'll be able to follow us on those two channels, and it will grow from there. But make sure that you do that. There also will be a way for you to share with us some topics that you may want us to talk about, specific to you. And there may even be an opportunity that we bring you on the podcast as well. From your fears, your misconceptions, share with us and share with the audience on, somebody that is potentially fearful about the opportunity to transition into your own independent practice. There's a lot of opportunity here. We are here to support you.
Yeah, well, I'll piggyback on that, on that, Amy, that, I talk to a lot of physicians, and sometimes even at a random bar, and I'll ask physicians, they'll be sitting next to one that works in a hospital system, and I'll ask, are you frustrated? And the answer is almost, pretty much always yes. So it's an interesting thing is that we know there's a big issue, but of course it's one thing to be frustrated, and then it's another thing to have a new lily pad to jump to, right? So, and then having that fear of, I didn't have business classes. You're asking me to kind of start a business here. One of the things I like to share in Wisconsin, and maybe someday this will change, but I think we've created enough momentum and patient flow. I know of no direct primary care practice or direct specialty care practice. In other words, physicians who have broken off and started their own practice in their own area that has failed. Not a single one. And that's kind of a bold statement. I know of a few that have retired. We went from 15 direct primary care clinics in the state in 2020 to over 130 today, which is good for this size of state. Other states have a few more, and some have like none or one in the whole state. But this movement's really kicking in. But what's cool about this is that we have the resources, right? The business knowledge with Phil and Heather, and we can hold their hand and help them. So the audience here might be physicians within the hospital system that are frustrated. It might be the practice owners that have already done this that are, and of course, looking to hire. Those are the ones going to be posting the jobs. And so we're here to support that whole full cycle and really help physicians fulfill their careers like they'd originally dreamed of.
That's a perfect transition into where can you find us. So we're first going to share with you that we have a website, which is a recruiting website for independent practices, specifically a jobs website. I'll call it like Indeed. It is called whitecoatlifeboat.com. So feel free. If you're an employer already and you need to hire those folks who have the right independent practice hat on, who understand that it's not just a job, but they're doing something to help with the healthcare of not only the business they work for, but the patients that come to that location. Whitecoatlifeboat.com. Make sure that you go there. There are also, if you're looking for your own practice or your own job at an independent practice, you can search the jobs that are in there. Currently, there are jobs that are in Wisconsin, and we are bringing more employers that will be posting more jobs on there as we grow. You are hitting the ground floor if you're listening to this podcast. Grow with us, share with us, and we will be there to support you. Thank you so much, Phil, Heather, and Matt. That concludes our first episode of Lifeboat for the Whitecoat. Catch us on the future episodes and make sure that you submit your recommendations of things that you want to hear us talk about. This concludes this episode of Lifeboat for the Whitecoat podcast. Please make sure you visit whitecoatlifeboat.com.